In the past, we've discussed SSRIs. It's the current treatment landscape. If we don't change the current treatment landscape, what do you think potentially could happen to society as a whole? Like this has to change. Do you not think we're at this point? Hey everyone, welcome to our latest TDR Psychedelic Exclusive, a great podcast we have here today. We want to talk about addiction and the global impact it's having right now in the current world that we live in. And we are very honored here today to welcome back to the podcast. He's a world-renowned English neuropsychopharmacologist, researcher, and advisor of Awaken Life Sciences, Professor David Nutt, back to the podcast. Great to have you on. Very happy to have you on. Good to see you.
Great to see you again.
How are things? You're in the UK. We were just talking off camera, a little bit outside of London. You spend a lot of time both the country land and obviously in the city too at the Imperial College of London. But you're keeping busy. And since we last spoke, how do you think the overall industry and research as to what you guys are pertaining is advancing? Is it good so far?
Well, I mean, to be honest, it's been a bit of a setback the last year, hasn't it? I mean, with the share prices of companies falling, some companies fusing, there's been a lot of uncertainty in the field. I think it's bottomed out, and I was so pleased to hear that Compass Pathways really got their refinancing for their
Isn't that great?
psilocybin trial. I mean, because if they'd have gone under, then that could have been a sort of death knell for the whole field. So, I mean, I find it weird that something this is so exciting and so revolutionary should not be, should be suffering from a sort of people, lacking confidence because it is a revolution in medicine.
Yeah, and I think there's not enough people that know about it yet. And I was obviously impressed with the data that MAPS came out with last month, which was very
Absolutely.
promising and great for the industry as well. But to your point about Compass, like there were some pretty sophisticated investors, and they didn't put in a couple million. Like this was almost potentially with the warrants, $250 million of investing by very sophisticated investors. So I think the smart people that are following this space closely, to your point, understand that this is a revolution
Mm.
and it'll happen in due time. But, as much as prices have bottomed out over the past year, do you feel the research as to what you're doing is still advancing?
Yes, remarkable. Because every month there's a new study published which shows that it works. Psychedelics work, ketamine works. I mean,
Mhm.
it's a MDMA works. That's why I think we should be on an absolute boom rather than let's hope we get another round of funding. But as
Yeah,
you
I
say,
hear
it'll
you
change. I
there.
think eventually the pressure and the knowledge will surely change investors, but also it's changing governments. Yeah, I think the
Yes.
governments, and I'm talking a lot with the European Commission, the Medicines Agency. They're everyone who's responsible for people who are ill with addiction or with other mental health problems. They want psychedelics because they know it's a breakthrough. What we've got to do is facilitate the companies paying for the trials to fast track it.
How much of a priority? Like you hear, like even in over in here in North America, it is a priority, but from what you're hearing in the UK and in Europe, based on your connections and your network, how much is this a priority right now? Because let's face it, we live in challenging times right now.
Yes, but it's because we live in challenging times. It's a priority because the truth is, we don't have any other insights into how we can deal with the chronic stress of modern life,
I know.
which has just got considerably greater as a result of what's happened in Palestine, in Gaza today. So,
I
you know,
know.
the European Commission has actually, for the first time, just announced it's funding a program which spans about 7 universities in Europe, and a spin-off of my charity Drug Science called Perea, to investigate using psychedelics for palliative care in people with terminal illness in Europe. And so that in itself is a major
That
development.
is.
Mm.
S What would you best like, how would you best explain the world we're living in today and the levels of addiction that pertain to it? Because I think the stats and just the overall perception is pretty alarming, but I'd like to hear it from you and what you think where we are today.
Well, we have, as in your country, last year more Americans died of fentanyl than died in the whole of the Vietnam War. Last year in my country,
Wow.
we had more people die of opiate overdoses than ever before any other year. So we now have the situation in Britain where alcohol is the leading cause of death in men under 50 and will be very shortly the leading cause of death in women under 50 because women are earning more than men and drinking more than men. So wherever we look,
Are they really?
they
Wow.
are. They and it's because they can afford to. And, I mean, I don't know what the situation is, probably the same in the States, but basically women
Yeah.
get better degrees, they're harder working, when they get into the workplace they achieve more, and they're saying to men, we're as good as you in terms of our work performance, and we're going to drink as much as you, which is unfortunately not as good for them because women tend to be more vulnerable. They have higher levels of alcohol for a given intake.
So alcohol is the leading death for people in the UK under the age of 50 and for women as well.
It will be soon in the next. Last year, well, I think they're hiding the data, but we had the 21 data. We saw a 6% rise in deaths from alcohol in women in 1 year. That's unprecedented.
How much have you seen this habit of trend increase since COVID?
Well, COVID was interesting because COVID had two effects. For people who drank quite a lot, they drank a lot more. And for people that didn't drink so much, they drank less because you had to make efforts to get it. But the people who were most vulnerable to alcohol, the people that were heavy drinkers, they tended to do badly out of COVID.
Yeah, of course. When we talk about, in the past, we've discussed SSRIs. It's the current treatment landscape. If we don't change the current treatment landscape, what do you think potentially could happen to society as a whole? Like this has to change. Do you not think we're at this point?
Well, I think we are. And I'll tell you, one country has accepted the need to change, and that's Australia. 2 months ago, 1st of July, Australia said, we are going to allow psilocybin for treatment resistant depression
Yeah.
and MDMA for treatment resistant PTSD to be prescribable by registered doctors.
Okay.
Why did they do that? In Australia, a population of about 25 million people,
Mhm.
every day a first responder kills himself, suicide,
Wow.
every day. So that's 350 a year. Australia has one of the top 5 health systems in the world. So all these people, because they're in um, government employed, they're all getting the best treatment they can get, and they're still killing themselves. So
Wow.
absolutely, we need to do something different, and that's why the Australians said, "What have we got to lose by making psilocybin and MDMA available now? Because if we wait for 3 or 4 years till the companies have finished their trials, we will have lost another 1,000 people who have given their lives to support people with injury and crime, etc." So they just said, let's just get on with it.
And that's only gonna get worse, right? If something doesn't change.
Well, absolutely. The burden of mental, the greatest burden of COVID was on mental health. We've got
Yeah.
about a third of our doctors suffering from PTSD because they were forced to practice medicine without the proper health safeguards for them and for their patients. They watch patients dying unnecessarily because we just didn't even have the right protective equipment.
Yeah. Well, I do know that a lot of people that follow Awaken Life Sciences, and I've had this conversation with Anthony. It's pretty remarkable when you look at the overall cost as to what it would take to run a phase 3 trial. And this being sponsored,
Mm,
yes, there is some money that's being allocated, but it's, I think, a little over $1 million is what he said
mm.
for a phase 3, which is unheard of. But how advanced do you think this trial is, when comparable to other trials that are going on currently in the industry?
Well, I mean, this particular trial is a really, is a landmark event in the sense that this is the British government or the National Health Service, its research arm, has said that we got to do something new and different and better for alcohol use disorder.
Hmm.
So it's a partnership, and it's the first time that the NHS has funded research a research trial with ketamine, and so and that's because they know there's a huge problem, and they know, of course, that ketamine is a completely new approach to dealing with the problem of alcoholism.
Yeah, yeah. Prior to join Awaken, What kind of relationship or contacts did you have directly through your career with the NHS?
Well, I worked in it for nearly 40 years, but actually, I resigned. I resigned about 7 years ago, partly because I was getting old, but mostly because we weren't getting innovation, and that's why I joined
Right,
Awaken. Because I couldn't in the NHS, I couldn't. I could only prescribe medicines that were approved by the NHS. And
right.
if there's no new medicines approved, then you can't do anything innovative. So I wanted to get out and I wanted to work in the private sector where it was slightly easier to use, particularly ketamine, but also to work with Awaken to improve on ketamine and to develop alternatives and maybe improve on MDMA as well, which is one of our other main targets.
Yeah, and obviously, when people are looking at this story, they're putting two and two together. How much realistic is it the fact that you worked 40 years at the NHS and the relationships that you have? You wanted to go on the private side, you wanted to look at innovation. Are they listening now? And based on that experience with them, is that one of the main reasons why you were able to get sponsorship through them?
I think so. I mean, I think look. I mean, I'm a pretty senior doctor. I've been a professor, in psychiatry for I don't know, nearly 30 years now. I think people, and I've treated thousands of patients, and I've written lots of books, and I think the NHS is beginning to accept that it needs to do something different, and it's certainly giving mouth. It's saying the words. We want change. We want innovation, and we want new ways of doing trials. We want to make trials more less expensive and more real world. So they are saying that. I mean, the proof of the pudding will be what happens if our phase 3 trial, the Awaken trial, turns out
Yep.
positive. Will the NHS then say, "Yeah, let's do it"? Because I think from a cost-effective perspective, we're going to be extremely good value compared with, say, residential care for 3 or 6 months.
So, okay, so the clinical trial application has been submitted for the phase 3. Timeline now, we're waiting to hear back from the NHS at some point this fall. Am I understanding that correctly?
Yeah, no, I think it's really is dotting the i's, crossing the t's now. It's just finalising the contract and getting the drug products, etc., organised. So we're going to be starting it early in the new year. Yeah.
How much of an impact, I guess, on society and the economy is like alcohol use disorder in the UK alone? Do you know?
Well, yes, I mean the government's own estimates are that it costs £30 billion a year, and if you look at the tax income, which is about 10 or 15, so
Yeah,
there's a real net deficit of between 10 and 15 billion pounds, so $20 billion.
that is a huge cost for one country.
Yeah, it is, and of course in Scotland, which is sort of part of our country, where the problem's even worse, it's even high. The rates of harm and the rates of death are even higher. Yeah.
Wow. So, if like, once this trial is up and running, 2027 is when potentially we could see commercialization of the actual drug.
Yes.
So, when we're speaking or when you're speaking with government officials in the NHS and you look at this being a $30 billion problem for the country each and every year,
Mm.
what's the solution then? What's the end result? If this proves to be based on some of the data that's come out so far, how could this actually change, which is obviously going to garner the interest from these government officials?
Well, I think we need to be clear that you don't solve the problem of alcohol health harms just by treating alcoholism. You've got to have a holistic approach. You've got to
Of
have
course.
fewer people drinking. You've got to have safer alternatives. You've got to make sure that people know what the limits, the safe limits to drinking are. You need a social approach, you need a taxation approach, and you need a medical approach.
How much do you follow what they've done in Portugal as far as decriminalization? Because it seems like the way they look at mental health in that country from some of the feedback I've received, like this has been a full advanced approach, not just about drugs in general, but it's about re-educating the entire people that live within the country that look at mental health in a different light. And that to me is a great example that more and more countries should be doing, right?
Absolutely. Funnily, you should. I was in Portugal 3 weeks ago. I
Were
was
you?
talking. I was talking about the use of ketamine to treat addictions because there is a group of clinics in Portugal that are interested in using this. I was teaching them, and there was a lot of skepticism by because a lot of psychiatrists think, well, hang on, this is a drug to treat another drug. You got an addiction to alcohol. You're going to give them ketamine, which is another drug.
Right.
But so there was quite a lot of resistance. But at my talk, I was delighted to see an old friend of mine, Tony Gual, who he was the guy that brought in the Portuguese program. And,
Really?
and we had a chat afterwards. He said, "Look, this is the future. You know, we've done it. We've done a really great job taking people with drug problems out of the criminal system. Now, what we got to do is really maximize the health interventions for them." And they've actually setting up in Portugal a national network of treatments for addictions, which they hadn't had before. So that's also so Portugal is really moving, continuing to move in the right direction.
Do you think there's more countries across the world that are watching what they're doing as far as what they've done?
Yes, they are. I mean, certainly most health experts accept that criminalizing people for using drugs only makes things worse. So
Yeah,
the evidence is strongly in favor of a more decriminalized approach. The problem is that's a political decision, not just a health
I
decision.
know.
But it happened in Scotland. You might be interested to know that just a couple of weeks ago, Scotland has a separate legislature in relation to health, and they've accepted that harm reduction can be a program they use in Scotland, particularly in relation to injectable drugs like opiates and cocaine. So that's now been accepted as being legal. In Britain, in England, we don't. The government says no, it's not legal, but in Scotland they said it is legal to set up a facility where people can take their drug, their street drug, and inject it, knowing that if they were to accidentally overdose, they could have a reversal agent.
What'd you think of the news last week pertaining to the governor of California and the bill that was signed off? Did you get a chance to see that?
Well, I thought that was quite exciting, wasn't it? Yeah. I mean,
Wasn't it with
I didn't.
Gavin Newsom?
Yeah.
Yeah, well, like I said, it's slowly, surely the step in the right direction. But I think. Do you think in any ways this is a generational thing? Like I know the whole war on drugs and the Nancy Reagan regime back in the 80s. We've spoken to even some lobbyists on the cannabis side.
Mm.
They've when they speak to Congress have made it very clear that yes, this is indeed a generational thing. But gradually over time, where do you see I guess this industry in the next 10 years?
Well, the reason I'm working in the field of addiction is because it is the greatest unmet need in medicine. I mean, the cost of addiction
I know.
is the same as the cost of schizophrenia and cancer. But the
Mhm.
research investment in addiction is 1,000th that of cancer and about 100th that of schizophrenia. So this is the great unmet need, and we have to
Wow.
get in there. But the remarkable thing is that we probably understand addiction as well. We understand it better than schizophrenia. We probably understand it as well as we understand cancers. Just the difference is there's still the stigma, there's still the politicization, the hatred of people who use drugs and get into trouble. We know, a large number of our politicians use drugs, but they don't get into problems. But we don't stigmatize those. But we like to stigmatize people who do what others do and get into trouble, and that's wrong. And we do have the tools now, and we understand the brain mechanisms. We've got innovative interventions. We just need to be fast tracking. If we put as much money into treating addiction as we put into finding a COVID vaccine, we would be solving the problem probably as fast as we solved, at least the COVID, the first phase of COVID, anyway.
That day's going to come though, don't you think?
I hope. Well, yes, I hope so.
You
Yeah,
hope?
yeah. I mean, it makes economic sense pursuing the current policies of criminalizing drug users. I mean, your country more than anyone. I mean,
I know.
many states are going bankrupt because you've got so many people in prison with these three strikes and they're out. I mean, thankfully they're changing that there now. But I mean, it it makes no economic sense to carry on using the sort of prohibitionist approach. We should use a medical approach, the Portuguese approach.
Yeah. Completely agree. 40 years at the NHS. Wow. And was most of the time spent on the research of addiction?
Well, no, I worked in other fields as well, but I've always had a soft spot for addiction ever since my very first day as a medical student. I go to Cambridge, I'm 18 years old. There are 9 medical students in my year. What do? The first night we get together and we all go out and have a drink. And
Okay. Yeah.
by the end of the evening, one of them was so drunk he was crying, and I thought he was going to commit suicide. I thought we were going to get a doc. He's suicidal. And one of his friends said, "No, no, he's always like this." And I thought, what? And that guy had serious. He nearly got struck off the medical register for alcoholism.
Wow.
Sadly, the guy that told me he's always like that. The other guy died of alcoholism in his 40s. So I had 2 out of 9 that I know of. Alcohol has seriously impacted their clinical careers. So from that day on, I was always thinking, there's something strange about alcohol, because it's the only drug that really does change your mind to put you at great risk of self-harm.
That is actually so that's how things changed and how you looked at research just as far as addiction a little bit differently because think of how many people can relate to a story that you just shared, right?
Well, yeah, and I'm sure if we that was the 9 medical students, if we went across to the 9 engineering students and the 9, they were probably all going through, similar numbers. We're having the same problems. Yeah.
Yeah. How excited and confident do you feel going into this potential phase 3 trial?
Oh, I'm sure it'll work. It worked so well in the phase 2 trial. I can't see how it. And remember,
Wow.
the phase 2 trial was also a multi-center trial, so it was a challenging trial to do. And multi-center trials are always the ones that tend to bring down drugs. But so I'm very confident.
That's great.
Yeah.
Um, I want to switch to your MDMA program.
Yes.
As we said off the top, MAPS came up with some really compelling data.
Mm.
And I was speaking to a couple of the executive members of your team last week about the importance of this. Do you want to maybe elaborate a little bit on just the actual overall program research and what you're looking to achieve through this?
Well, I've been really impressed with what MAPS have done, and I take a little bit of pride in it, because we actually did the
Great.
10 years ago the brain imaging study, which made sense of what they were doing. They had developed a program of psychotherapy with MDMA sessions that was really powerful for PTSD. But no one had ever tried to work out what it was doing in the brain, and it was very difficult because the drug was illegal, and you couldn't get funding from most governments to do it. But we actually got funding from a TV company to do the brain imaging study, and it showed it.
Really?
Yeah, that's right, absolutely. We got Channel 4, a British TV company, paid for us to do the brain imaging and show people what MDMA was doing in the brain. And what it's doing is exactly what you want it to do, what MAPS want it to
Which is
do,
which is what?
which is dampen down the emotional centers of the brain so that people with PTSD can remember, re-engage with the trauma without the emotions completely overwhelming them. Because,
Wow.
PTSD is a disorder in which a previous event resurges in your brain.
Right.
And what's damaging with PTSD is the fact that for instance, if you were shot in Iraq and you hear a car exhaust misfire, your brain says, "I am being shot again." So all the fear of being shot just comes straight back to the surface, which is really debilitating. Now, the therapy that MAPS use and other people use is to get people to talk about the trauma, try to relive the trauma in,
Right.
in a sort of factual sense. And then as the emotions come back, you hold them long enough for them to extinguish, they burn out. But for many people, and I've been researching PTSD for over 30 years, for many people, as soon as you say let's remember the trauma, they just collapse or they run out of the room, they faint because the emotions are so overpowering. But MDMA in the brain dampens down that emotional centers and allows the person to contain the emotion and then get control over it, and then basically get rid of it. You don't forget the facts you were blown up, but it's the facts don't, in the end, if they're not associated with these terrible emotions, they don't disturb your life so much.
Well, think about even outside of just military veterans.
Yeah.
How many times you see day-to-day people that are stressed out that have a massive panic attack and don't know how to deal with that?
Mm.
Like that is that classified as PTSD?
No, I mean, there is actually a very interesting. It's a bit subtle, but there's a fundamental difference between a panic attack and a PTSD attack.
Yep.
And the difference is that in a PTSD attack, your brain says, "I am being attacked." It behaves as if you are, because as it used to do when you were being attacked, you had a fear response, and a PTSD attack is the same thing. Whereas a panic attack is different. In a panic attack, your brain is saying, "Oh, I think I might be ill. I might be having a heart attack. I might be having a fit." So it's one is I might be, and the other is I am, and that is why PTSD is so damaging. Because with
Mm.
panic, you can help people reason. You can say, "Well, of course you're not having you're not having a heart attack because your heart's normal." Let's test that. Let's just see whether you are having a heart attack. Let's run up some stairs and see if you die.
Well,
They don't die. But in a PTSD attack, you cannot reason out of it because it's beyond reason.
I bring that up because there was the one chapter, I think, episode in How to Change Your Mind.
Yes.
And one of the ladies that was there had panic attacks for 30 or 40 years. And every single day she had a constant fear of dying. So what I'm get is PTSD separate from, say, something like that? Because think of how many people are living through that on a day-to-day basis with the daily stresses that we currently
Well,
incur.
yes. Yeah, I mean, I don't want to minimize panic attacks because I spent a lot of my life trying to help people get over panic attacks. And actually, the SSRIs are extremely effective treatments for panic attacks. They're very,
Hmm,
very good. And I actually don't know, and we've never tested it, whether psychedelics would work in people with panic attacks.
hmm.
So it's an open question. But you are quite right. I mean, having a panic attack 2 or 3 or 4 times a day over a period of years is completely destructive to people's lives, and
Yeah.
so it can be as absolutely as damaging and as impairing as having PTSD. Yeah.
Well, I'm glad that you explained what PTSD, as we said, maps with their data. It was very, very good. Um, Results will lead to probably a new drug application filing with the FDA. So your company, Awaken Life Sciences, announced your own completed feasibility study for its proprietary formulation of MDA using Catalent's Zydis orally disintegrating tablet technology. So real quick, Catalent's Zydis, who are they and why is that important?
Well, it's important because it's a different way of um, giving people MDMA, and we think we can shorten the MDMA therapy. Currently,
Mhm.
the MDMA treatment lasts between about 6 and 10 hours, and that's very demanding on the patient and also very demanding on the therapist. And we are looking to see if we can consolidate it down into a period of a couple of hours using this different administrative technology, and that will bring it into the same time scale as ketamine and some other psychedelics.
Do you think that MAPS just basically, with the progress that they're making for the new drug application and advancing its therapies, like I would think this is going to have a positive indirect benefit for ketamine treatments too. Do you not think?
Oh, yes, I think so, because people understand that the concept of drug assisted psychotherapy, whether ketamine or MDMA, to help people get rapid and powerful changes in their way they view their present problems and their past problems I think it's transformational. I think it will become a central part of psychiatric therapy for many different disorders. I mean, today we're talking about PTSD and addiction, but there's also the depression, there's also OCD, there's also
Yeah.
neurological disorders like chronic pain. I think this is the big revolution in the treatment of brain disorders we're going to see over the next 10 years.
Hmm. I can't help but agree because when I look at everyone's overall attitude and demographics that are rapidly changing in society, I think people are starting to look at, for example, alcohol use disorder a lot differently. I see a lot of what sports athlete talked about anxiety, depression, all that sort of stuff, mental health 10, 15, 20 years ago. Never.
No.
And you're seeing that widespread now. So I think those are the types of things that get, I guess, get everyday people to open up and look at things differently, and it become more and more acceptable. So once you see it becoming more and more awareness and acceptable in society, I guess the question asked for like an institution like the NHS, like how much of it is a priority for them, an important focus for them
Yeah.
on fixing this long-term problem.
Well, it should be a priority. The problem is, there is still in society itself, despite the point you make about how more and more famous people, sports people are opening up to their problems,
Yes.
there's still an enormous stigma. There's still this, it's, well, just pull yourself together, Oh, of course, I'd be depressed if I had your shit life. Great. Well, thank you. We we don't prioritize mental health, and as many people have said, there is no health without mental health. Mental health is central
Hmm.
to all. Even the likelihood of getting cancer is partly determined by your mental health over the previous decades. But we have become obsessed with focusing on physical health because it's easier, it's more tractable. We can take cancers out, we can look at them under the microscope, we can invent new treatments for them. We can do that much faster than discover new treatments from health to health. So there's a whole constellation of factors which have made it hard or dissuaded people from moving in the mental health space. We now need incentives. Governments need to give incentives. I've been
Yes.
arguing for 20 years. It doesn't make sense. You can put a new cancer treatment on the market in 5 years. It takes a minimum of 10 years. MAPS have been going for 30 years to put a new psychiatric treatment on the market. For both, but both of them, you just get your 11 years of patent protection. That does not make sense. We need to incentivize treatments for mental health.
How many people do we know off the top of our head that pass from cancer across the globe every year? Like mental health and cancer, like what's the bigger industry?
In terms of deaths, well, if you look at, it's complicated because we know that the biggest killer in the world is tobacco, but that's an addiction which leads to cancer, so they're a bit intertwined.
It's well
That's
said.
7 million. Alcohol's 3.5 million. So alcohol and tobacco together are more than all the infective diseases in the world, and
Yeah.
probably I would have thought 2 or 3 times those from cancers. But as I say, the cancer's intertwined, so it's a bit tricky because
Yeah.
people with alcohol die from liver cancer, etc.
I could talk to you all day. I really could. It's fascinating. Last thing I want to touch on is just an update. There was news last week pertaining to Awaken and their MDMA program. So maybe outline what that program is about and next steps as to why I think people that are following your story should pay close attention to.
So what we're trying to do is make MDMA therapy more affordable, more tractable, reducing the course of a therapeutic day from a whole day to half a day, so to bring down the duration of the effect. We know from work with our ketamine work that a 1 to 2 hour experience can be very therapeutic. If we could bring the MDMA experience down to 1 to 2 hours by using this new technology, which facilitates absorption, etc., then we could actually reduce the time people need to be in the clinic, and that would have a massive cost saving, and both to the therapists and to the healthcare providers.
Well, you bring up a good point because MAPS has some compelling data to say the least. This is groundbreaking. However, there's a lot of people reaching out just to say, how does this work as far as the clinical model? Because I've heard stories that insurance companies may only cover the first hour of treatment, and this could be a 6 to 8 hour treatment per day. And then there's the other things like how do you scale up, have the right amount of therapists and clinics, and how that all works because this is going to be in a clinical setting. But first things first, 6 to 8 hours, is that realistic?
Well, at present, that's all we can say. We've got the evidence for us, but it
Yeah,
is in the long term. No, I think it will limit the availability just to people who are very rich, or possibly to special groups like maybe veterans if the Department of Defense pays for it. But now we know it works. What we have to do is refine it, and that's what we've done all over the years with all sorts of medicines. So that's what Awaken's trying to do. Let's try to focus on the pharmacology of
right.
MDMA and bring it in a way which means you could potentially half the cost of the therapy.
Well, it sounds obviously interesting when you can narrow something down from 6 to 8 to 1 to 2 hours, but you're saying technology, the technology that you're planning on using. Like, what are you hoping to get out of this? Like, how exactly does that work? Is it too good to be true, or does it sound too good to be true?
No, it's an established technology. The Zydis technology is a way of presenting medicines through the mouth, through the oral cavity. That's been. We know that some medicines, and we think MDMA will be one of them, can be very rapidly absorbed through the mouth. Uh, I mean, people who use cocaine know it's absorbed pretty fast through the nose, and it's the same kind of membrane. So there is no
Yeah.
reason why it couldn't be absorbed. And if it's absorbed faster, you then get to the peak faster. And then if you get to the peak faster, if you adjust the dosing, you might well then discover that you can have the effect consolidated over the first couple of hours, and so you don't
Hmm.
have the enduring, the long lasting experience. It needs therapists present all the way through.
And who's the company that you're actually working with pertaining to that MDMA program?
Well, there's the people that make Zydas, they're called Catalent, and it's a technology they have developed. I mean, it's actually quite widely used in. I mean, some of you probably, I don't know in America, but in Britain, you can have this film on your mouth to take things like acetaminophen, paracetamol. In
Yeah.
psychiatry, we use it widely for medicines. There are some people can't swallow either because they've got anxiety or because they've got spasms in their throat. So you can use this. There are many psychiatric medicines which are presentable in these oral thin films, which allow it to be absorbed quickly. And we know, that's actually quite a good way of getting medicines to help deal with people who've got acute agitation to respond quite quickly.
Yeah. I think it's important to share to my audience too. Can you maybe explain who Catalents is and the importance of them and their kind of background, which
Oh, they're
people
the
could
world
start
leaders.
putting two and two together? Yeah.
Yeah, I mean, they've invented the technology, and they're a huge company. I mean, they've got 400, I think, people working in their research offices in Germany. So they're a massively successful technology development company. Not just for I mean, they're moving into psychiatry with us, but up till now they've been in other areas like antibiotics and pain control, etc. They're drug delivery experts.
Yeah. And a big track record with Big Pharma, I would think. Yes.
Yeah, I mean they are kind of big pharma, but certainly with other big pharma, yes.
Exactly. Well, listen, this has been great. I'm glad that you kind of painted the picture as to what the addiction concept looks like, the economic impact that alcohol use disorder has on the UK and Scotland alone. Like that was a real eye opener. And I cannot believe that, as you said, stat wise, that the leading cause of death for men under 50 in the UK is alcohol use disorder, that's an eye opener.
Yeah,
Big opener.
quite. And it's probably not far off. I mean, I don't know the US data, but I'd be surprised if it was. You probably get a few more of them killed through guns, probably.
No,
But after
yeah.
guns, it's probably alcohol.
I think Anthony told me at a previous podcast there's as many as 15 million per year that are dying from alcohol use disorder in the US alone.
No, it can't be that many.
No?
It can't be because it's 3.5 million across the world. But you might have,
Oh,
it could
okay.
be 1.5
Maybe
million. Yeah.
I'll Google that up, make sure I know what I'm talking about. I don't want to float any crazy numbers around. But yeah, needless to say, it is a huge problem. I don't know if you see like some of these Netflix documentaries like Painkillers or Dope Sick, but it is a rich history story on Purdue Pharmaceuticals. And
Yeah, remarkable. That was actually a remarkable series. I thought both in terms of the content and the acting. It was absolutely really impressive. But can I make a comment about American TV and about
yeah, of
this?
course.
Almost every program I watch on HBO, Netflix, or whatever, it comes up with a warning contains alcohol. And
Wow, good
almost
point.
every meal you watch, people, you do this over the next week. Every time you watch something on the television or the cinema, just see how many times people have a meal without alcohol. The only time the only people that don't drink alcohol with meals are people that go to diners, but it's every meal in someone's home there's alcohol. I mean,
Yeah,
I
that's a
was
good point.
particularly intrigued by the Big Little Lies series. Not only do the women always drink alcohol with lunch and dinner, but they have the giant schooners. They were, on average, at least there were probably 200, 250 mils of alcohol. And that's a day's supply, and they were drinking that. And we've just, the alcohol companies have become very clever at normalizing the drinking of alcohol, particularly
Yeah.
wine. And that's one of the reasons death rates in women are going up because they're drinking wine on
Yeah.
a really regular basis.
Yeah. Well, you're definitely seeing more and more where a lot of these brands want to have product integration into actual programming because in today's day and age, people are tired of seeing 30-second commercial ads.
Yep.
But the more and more that you integrate product integration into content like that, like you said, it becomes normalized. But that's a really good point. Almost every single series, there's a warning. Alcohol
Yeah.
is at the forefront on every single one. You're right.
But on the other hand, yeah, I mean, it's a warning, but apart from people like me, who cares? What the clever thing is, I mean, this is what the industry is really, I mean, it's completely normal. If you're an attractive woman living in on the west coast of America and you're in the film, alcohol is central to your life.
Yeah,
And
you're
that is
right.
wrong. It shouldn't be. You should be allowed to eat some meals without drinking.
Well, think of how much addiction spreads like wildfire in Hollywood alone. Think of how
Well,
many people in Hollywood with these, you know, second personality personas as to like who the actor is versus the real life person, the
mm,
fame, the fortune. I can't imagine what they would have to deal with on a day-to-day basis. And as soon as that fame and fortune in the beginning of their careers starts to fade, then they can't go to the grocery store. Or if you start to go down a bit and your career starts to go by, you put yourself out in the public eye and people start to,
yeah,
look down at you. I can't imagine the pressure. And let's face it,
yeah,
I think so many people that are in Hollywood, I know my field in broadcasting, a lot of addiction, a lot of alcoholics in the industry. It's an egotistic, you lead with the ego when you're going in with that sort of thing. But I think over time, I think if people can understand that if you try to provide content that helps others and educate, that actually is what it's all about.
yeah, absolutely, exactly. Well, and there are countries which actually take the profits from alcohol and feed them back into treatments, but unfortunately,
Mhm.
not we don't, and nor do you. Yeah.
Yeah. Well, listen, always great speaking with you. Please keep in touch. Great work, obviously, on the submitting the application of the phase 3 trial, and then as well as the updates within your new MDMA program. But this has been great, and let's keep in touch, okay?
Thanks. Lovely to talk to you as always, Shab.
As
Thanks.
well. Thank you, Professor Nutt. What's up, everyone? So, what'd you think of the interview? Are there any more questions you want us to ask that you want to learn more of? Then leave a comment below and let us know what you think. As usual, share this video with your network, smash that like button, and most importantly, subscribe to our channel because we would not be here without you. Thanks for watching, everyone.